to your talks. I would call upon next speaker, Dr. Raka Chatterjee, to talk on lid tumors, the warning signs.
Good afternoon. Thanks for the AIOC for giving me this opportunity. Now, lumps and bumps in the eyelids can present in many ways. As for example, this child presents with a lesion like this, or can an elderly gentleman is presenting with a lesion like this. Now, the approach and the prognosis of these cases will depend on the ultimate histopathological diagnosis. But we need to know certain warning signs when we should be alert enough to consider these cases to be most likely the dangerous, the malignant ones. Now, the eyelid lesions are common, whereas the pattern recognition and the knowledge of common characteristics aid in the assessment of malignancy. Ulceration, irregularity, telangiectasias, pearly appearance, and loss of eyelid margin architecture. These are the 5 key features which suggest malignancy. The failure to diagnose and treat in a timely manner can lead to local tumor growth with possible direct extension to adjacent ocular surface or bit or skull bone. Late treatment may require extensive resection and reconstruction. So early detection of the eyelid cancer is the key. Now, the timeline of symptoms are like that. It can be a newly and rapidly going lesion, or it can be a long-standing lesion with a recent transformation. The different risk factors are advanced age, significant sun exposure, personal or family history of skin cancers, genetic predispositions, poor radiation therapy, or immunosuppressions like certain genetic diseases, and also graft transplant patients, patients on immunosuppressive therapies, HIV positive patients. The red flag signs are for any eyelid tumors, the bleeding, crusting, the non-healing, or the recurrence. So as I already told that 5 points, that ulceration, irregular border, telangiectasias, pearly appearances, and loss of eyelid architectures, these are the characteristic features of malignant periocular cutaneous lesions. For malignant melanomas, these are simplified as ABCDE. These are asymmetry, border, color, diameter, and the evolution. That is how it is growing. Now, the ulceration develops as the malignant cells grow haphazardly and are thought to outgrow its own blood supply. With a nodular basal cell carcinoma, the tumors are perfuse peripherally, so there is central ischemia and ulceration, whereas the squamous cell carcinoma, it is at the periphery of the lesion. In melanoma, ulceration suggests a more aggressive subtype. Here you see the 2 lesions, the first one with a small regular lesion with a central deep umbilication, but this is a molluscum contagiosum lesion. This is not a malignant one, the upper left. This one. And this is a case of central black depressed area with a tumor, but this is again a benign, it was a sebaceous cyst. Now that these lesions are little suspicious, this one, this one, this one, this one, these are the ulcerated lesions with malignant histopathology. This is another case where there is extensive superficial ulcerations, and incision biopsy proved it is a case of squamous cell carcinoma of the upper eyelid. Now, regarding the irregularity, because malignant tumors often have scalloped margins with asymmetric shapes, where the benign lesions such as syringomas, epidermosis typically have a smooth discrete border with a symmetrical shape. This irregularity occurs due to the presence of multiple cellular population growing at different rates. So, as I show you, this is a lesion, margins regular. This one is also having a regular margin. This is, you know, is a clinically chalazion. This and these two looks like junctional nevi, and this is a pyogenic granuloma. These lesions do not look like malignancy. The margins are irregular. Margins are regular. Whereas these lesions here, this is a lesion with a clinical irregular margin. This is an eversion of the tarsal plate. You see how the margin looks. Here also it is an irregularity, bumpy appearance, and here it is not only irregular, the loss of eyelid margin shape is changed. The third is a telangiectasia. These are dilated irregular small blood vessels of the superficial dermis. While isolated telangiectasias are commonly seen in older sun-damaged skin, but telangiectasias overlying a raised scaly or irregular skin lesion should raise the suspicion. Here we see on top of this irregular lesion, the telangiectatic blood vessels are there. Here also, in the upper part, the lesion looks little whitish and there is a contrast reddish blood vessels apparent. The pearly appearance is just like a pearl, a whitish and shiny appearance. It is a suspicious, particularly for nodular basal cell carcinoma patients with a scallop pearly border and translucent appearance. It gives rise to a suspicion. Here, this is that I was telling you that the upper part is whitish and it looks like typical pearly papule, and there is a central ulceration. It is histopathologically, it was a case of basal cell carcinoma. And again, the loss of eyelid architecture, loss of eyelid margin architecture, meaning erosion of the mucocutaneous junctions, focal depressions or notch or other obliterations of eyelid margin landmarks, such as the meibomian gland orifices, lash line are suspicious. Now, mother-osis and necrosis also add to this. Now, this is a picture where you see how the margin irregularity, no lashes, no lid margin architecture. This was histopathologically proved to be a case of sebaceous gland carcinoma. Now, eyelid eversion is an important point. We should not forget whenever we see any lid lump or lesion, because it gives quite a good clue to what can be the clinical diagnosis and what can be our approach. Because if we forget to evert the lid and externally we see a round lesion, regular lesion, but internally the lesions, none of these lesions are quite satisfactory. These are suspicious lesions. Now, one important interesting case I'll show you is a case where the lesion looked something in eyelid, epidermoid cyst like that, but on excision it was a case of spindle cell tumor of the eyelid. Whereas this was a very thick lower lid with the mechanical ectropy, and histologically it was a case of hemangioma. Now, just to conclude, I will not discuss the theory parts. It's a case where this is clinically what is seen. All these are cases where basal cell carcinomas. Here the first one is with the rolled irregular margins with the ulcerated area. Here this is a pigmented one, and this is as I shown in the previous slide. Now, the second one is the eyelid is completely destroyed. It was histopathologically a squamous cell carcinoma. And the third one is much awaited and the commonest cancer seen in the Indian subcontinent. This is the condition of the eyelid. This is one where, and this is another type of carcinomatous erosion of the eyelid, and this is the third type. Now, all these cases, this was histologically proved to be a case of sebaceous gland carcinoma. But last but not the least, I'd like to show you a pigmented lesion in the conjunctiva extending into the eyelid. It was a case of simultaneous eyelid and conjunctival melanoma, contiguous. So to conclude, eyelid cancer is common, with sebaceous gland carcinoma being the most prevalent in Indian subcontinent, and high index of suspicion is mandated. Approximate referral in cases of suspected malignancy by general ophthalmologists to the more specialized persons.